I'm Dr. George Flynn, and I have got a good friend of mine, Dr. Joseph Santoso. We've been friends for years, and he keeps me up to date. He is a GYN oncologist. He's not only went through school in medical school, internship, residency, and OBGYN, then he specialized in OBGYN oncology or GYN cancer. So Dr. Santoso is with me. He's got some new guidelines on some different things, and the beauty of Dr. Santoso is he's able to explain it where you and I can understand it. So, Dr. Santoso, what are the new things that are coming out in medicine in 2021?
Many things. However, I like to kind of emphasize on prevention of cancer. And we already know that cervical cancer could be prevented with pap smear. And then in the last few years, the HPV testing has become more important. HPV is a human papillomavirus, and we seem to realize that they are responsible for 99.99% of cervical cancer.
Okay.
However, the guidelines keep on changing because we learn more and more. And one of the most recent development is the age of screening. A while back, we recommended women to start getting their pap smear at age 18. But then we realized that is a bit too early. So we move it up in 2012, I think. We move it up to age 21 years old. And then in 2020, just recently, just a few days ago, the American Cancer Society pushing it to start cervical cancer screening at age 25. So that's the first change. The second change is rather than using pap smear, American Cancer Society also pushing it for using HPV testing alone, not including the pap smear. Now, I like to caution you, this is American Cancer Society changes proposal. There are other society that involved in American women care, including cancer screening, that not exactly in the same page. So I like to talk to you more about that discrepancy because you will see your OBGYN, your nurse practitioner, your primary care doctor, and they may have different recommendation. And I want you to be more understanding because the changes are there, but it still will take a while for all of us to adjust and agree what will be the best guideline to do it.
So we're saying that there are new guidelines, and that one of the new guidelines we talk about pap smears, and I think most people watching know about the pap smear. That is, you're talking about cervical cancer screening, which is not necessarily pap smear. You're talking about HPV testing. So,
Correct.
but it's beginning at age 25. Now, at age 25, to go back and, say it one more time, what should people have according to the new guidelines? And then we'll go into the discrepancies.
Sure. The I'm going to making it a contrast between the established guideline and the newest guideline.
Okay.
The established guideline is you should start getting cervical pap smear at age 21 up to age 30. After age 30 to age 65, they recommend getting both pap smear and HPV testing. So that's the established prior 2020 guideline.
Right.
And the main reasoning is this. From age 21 to age 30, we just want only to do pap smear because if we do HPV testing, we will have many false positive tests. False positive means you have HPV testing positive, but it may have little health consequences on you. When we're young and more sexually active,
Mhm.
we often get HPV infection, but not all HPV infection will transform your cervix into cancer.
Mhm.
So if we do HPV testing at early age, we ended up getting what we call false positive. So that's why many organizations recommend age 21, just do pap smear every 3 years up to age 30. We think that after age 30, sexual activity decreases and your risk of getting HPV infection has decreased, so you don't have to compromise. And by combining both HPV testing and pap smear together, starting age 30 to age 65, you obtain both the highest sensitivity and specificity of the testing. So this is called co-testing. So again,
what is HPV testing? Is it a blood test? It is a cervical smear? What is HPV testing?
it is a cervical smear, but in addition to getting the cytology or looking at the cell, they also send it for the DNA or the RNA or certain protein to test whether there are HPV or not. And
in the past, we would have to tell people what DNA and RNA was, but now with COVID, everybody knows what DNA and RNA are. So I think that's been one thing. It's educated the public to be able to talk in these very sophisticated terms. So
yes, ma'am.
So
yes.
So now that's the old guidelines. What are the new guidelines and what's changed?
The newest guideline, which I'm a bit I'm not ready to jump in yet because I want to let that guideline to go through the discussion with other organizations before we take it full heart. But it's important to understand why American Cancer Society recommending that guideline too. The newest guideline published in 2020 is to start cervical cancer screening at age 25, not 21. Okay. And in contrast of using pap smear or cytology, ACS, American Cancer Society, recommend using HPV testing only. The reasoning is for pushing the age from 21 to 25 is because the HPV vaccination. The ACS thinks that with widespread HPV vaccination, we have reduced the incidence of precancer and cervical cancer. So we don't have to do it too early. And if we do it too early, we end up doing more testing and increased anxiety, increasing costs, increasing injury to the patient. So that's the reasoning to age 25.
At what age should HPV vaccination be? Everybody knows about vaccines these days, mRNA and regular vaccine. Everybody understands vaccines just about. At what age should people become vaccinated? And notice I said people, males and or females. So tell us what you think about that.
The recommendation, if I recall, is as early as age 9 or 11 years old, you could start doing the HPV vaccinations. And this is a DNA, HPV is a DNA virus, so it's more stable genomically, and it doesn't mutate as much. So since 2000, I think publication was 2006, we're still using the same one, but we expanded from covering only 4 HPV types. Now we cover 9 HPV types. So I highly recommend young adult or children ideally getting this vaccine before sexual activity, because once you get infected with HPV, then kind of the protection becomes less effective. So try to get that in as early as possible. And your pediatrician, your family practice, your nurse practitioner could help you markedly with that.
Should only females be vaccinated?
No, we should do both. The reason is because it takes two genders
to tango
to transmit HPV to each other.
Right. So you want to, and males are usually, they can be the carriers and not even know anything. Are there any symptoms of HPV?
Usually not. But HPV not only could cause cancer, but could cause warts. So an indirect way of saying that I've been infected by HPV is when you see growth in your genital area. This could apply to both male and female.
Okay. So are all warts HPV?
Yes.
Okay. So
mostly 90% of them are due to HPV 6 and 11.
Okay. Now, are the ones that you have, the warts that you see, are those the ones that can cause the cervical cancer?
No, sir. The good thing is warts, although it's horrible looking, painful, irritating, and so on, but usually do not convert into cancer.
Okay.
You have other type of HPV that could convert into cancer.
That's
Skin.
what I wanted our audience to hear from you. And so the new guidelines are that you only check for HPV after age what?
25.
25. But the vaccine, if you've been vaccinated, do you need to check for it?
Yes, you still continue doing the pap smear. I'm sorry, the cervical cancer screening, depending on which guideline you're going to use.
Right.
It's either pap smear or with HPV testing. The reason is because the HPV vaccination is not 100% accurate
Right.
or
Okay.
valid. So you could get the vaccine and you could still have about 10%
Yeah.
risk of developing cancer. So we want to catch it using cervical cancer screening.
Okay. So once you catch that, then the treatment, the earlier you catch it, the better the treatment. And that's one of your big things that you do is treat that disease.
Yes, sir. So any cancer, ideally you catch it before it becomes cancer, when it's precancerous. Even better is prevent it to begin with. And
so you can get a precancerous.
I'm sorry?
You can determine it before precancerous. And once you do that, you're able to go ahead and treat that.
Yes, sir. What we call it is cervical dysplasia, or just fancy word of saying abnormal cell growth in the cervix. And you could take care of it with just excisions or laser or things like that. And you could cure precancerous that way. But even better is you could prevent precancer and cancer. Number one is you use vaccine. Number two is be careful about sexual activity, because HPV is mostly 99% transmitted sexually.
Okay. And so I hope you have time to come back and talk to us more about things as they progress. And we'll even talk about COVID-19. And, we don't know what the late term effects of those are. And have you gotten your vaccine yet?
Yes.
Okay.
And highly, highly recommended. I mean, it's amazing accomplishment that we, human species, and everybody in the world could work together and accomplish a vaccine against this virus in less than a year.
And this is a once in a lifetime thing, we hope, because the pandemic of 1918 and the Spanish flu and that happened, and we still have made great strides, even though the best thing is mask, social distancing, the same thing they did. And they knew how to do it. We just need to firmly adhere to those guidelines and get the vaccine as soon as it's available to you. And I really appreciate you being here. And we will have many more talks, and our audience keeps asking for Dr. Santoso to come back because you give such great material, and we really appreciate you being here with us.
Thank you, Dr. Flynn.
I'm Dr. George Lynn. Thank you for being here with us. My guest has been Dr. Joseph Santoso, and it's easy to get in contact with him. We'll put his contact information at the bottom of the screen so that you can contact him if you have any other questions. I'm Dr. George Flynn. Thank you for watching. We'll see you next time.